to the intervention.
Philippine National Anthem.
Grant good health and safety to loved ones.
In 2022, about 2.3 million women were diagnosed with breast cancer worldwide, and 670,000 passed away already. Every 14 seconds, somewhere in the world, a woman is diagnosed with breast cancer. I'm not saying these facts to scare you, but to encourage you all to listen carefully to our guest speakers and feel free to ask them relevant questions during the Q&A.
Afternoon. Please allow me to introduce our third and last guest speaker in this afternoon. He is a renowned surgical oncologist in the Philippines, graduated from University of Santo Tomas School of Medicine in 2009, where he also obtained his medical degree as an academic scholar at the Faculty of Medicine and Surgery in 2013. In between surgical training, he completed his USMLE ECFMG certification, allowing him to pursue fellowship training in surgical oncology at the Memorial Sloan Kettering Cancer Center in New York. He has multiple publications on renowned journals focusing on cancer care in the Philippines. At present, he is affiliated with the Chinese General Hospital and Medical Center, St. Luke's Medical Center, and Cardinal Santos Medical Center. Without any ado, let us welcome our Dr. Christian Daniel Okang.
Hi, po everyone. Good afternoon. I hope everyone is still awake. I promise to make this lecture very short and very straightforward, okay? Next slide, please. This is the outline of my presentation. First, I'll talk about breast cancer statistics in the country. Sige, bantay tiyong yaw. Because if we mention numbers, I think everyone would relate and know how widespread breast cancer is. Second, I'll talk about the must-knows of breast cancer. Meaning, wabikap din kang higit mga wa-feel longchong lang kaming tsay about breast cancer. Because in this day and age ng social media, bantay ito'y fake news, bantay ito'y umtiyo na information. But this afternoon, I'll be sharing evidence-based data on breast cancer. Third, I'll talk about the methods of early detection, or the methods that we need to do to catch breast cancer early. And lastly, wabikap din kang the risk factors, or what makes a person high risk for breast cancer. So everyone would know what to watch out for. Okay, so that's the organized outline this afternoon. Next slide. So I'll begin with some statistics. The Philippines' #1 cancer in females is breast cancer. Mr. Samuel mentioned this earlier. Every 14 seconds in the world, someone is diagnosed with breast cancer. But here in the Philippines, statistics show that in 2022, there were 33,000 new breast cancer patients in that year alone. If you do the math, that's chapato, chitsap gowe sine breast cancer patients per day. So chichundan shi chitsap gowe cancer, bina chitsap gowe ulit. The day after chitsap gowe, so bantay so ilang u breast cancer la talaga. That's why it's not surprising to know that the Philippines ranked #1 in breast cancer in the whole of Southeast Asia. And this is according to the World Health Organization. Next slide. In 2022, approximately 12,000 or ching elang see from breast cancer. And the reason why this is so is because 65% of breast cancer patients in the Philippines are diagnosed late stage. In other words, hindi ati breast cancer ya advanced lola. This is very sad because in first world countries, Bangkok, Hong Kong, Singapore, Japan, Korea, first world countries, in the diagnosis rate of breast cancer, early stage is 62%. So we can see this Philippine statistics complete opposite talaga. Next slide. So just to give a brief background, Chinese General Hospital or Zhongding is one of the oldest hospitals from Philippines, established in 1891. It's owned and managed by the PCCAI. Next slide. So then it needs kuya bantay tuwala. Beds, 800 beds. 700 is for private patients, 100 for charity. Gunukaw pa kuya isang and siyang laki na kang ang employee. So ya bantay tuwala talaga, okay? So I'll be now sharing breast cancer statistics database from our hospital. From 2022 to 2024, we did 1,200 breast surgeries. Among this, 898 is for breast cancer specifically. Only 305 were for benign or MC cancer. Pero is for breast cancer. Among this, if we further subdivide this, 486 or 54% is for early stage breast cancer or early stage. And 412 or 46% are those that were diagnosed late stage, okay? So the take-home message here is 54%. Because if we compare our data to that of the Philippine average, 54% versus 35%, which I mentioned earlier, we could say that our hospital is doing well. Kasi we are able to detect breast cancer at a higher rate than the national average. So, boy paiko. But if we compare our statistics with that of first world countries, we can say that we still lag behind. Di ba kung din mention, Chama, in first world developed countries, the detection rate is 62%. So we can see we still have a lot of catching up to do. That's why the key message here is early detection is the main problem of breast cancer in the Philippines. Dan ya bantay to ipichu, dan ya to ya gawe isang, breast cancer could be treated here. The problem really is early detection. That's why, again, I'd like to take this opportunity to match that of first world countries. So that's it for the first part. Now let's talk about the second part, which is understanding breast cancer. So what can I see by sharing with everyone a little anatomy? What is the breast? Breast, okay? So the breast is a glandular organ. Must have lame, duwe, katway, but longchong lang ula. It's found anterior here and then the chest area. Breast, ya, bantay ito parts. They have lobules. Lobules, sige mga chidyap ko tamya, they're the ones responsible for producing milk. We have ducts. Ducts is sige mga kanang nawasa pipes. They connect the tubules to the ducts to the nipple. Para pag breast milk, they transport the milk to the nipple. We also have the nipple, which I mentioned already, and the areola, and lastly, fatty tissue. Fatty tissue is the reason why breasts are soft and redundant for women, okay? Breast cancer could develop there. If it develops in the ducts, it's called ductal carcinoma. That's the most common subtype. I'm sure you've heard of that, ductal carcinoma. If it develops in the lobules, it's called lobular carcinoma. If it develops in the nipple or areola, it's called Paget's disease. The key message here, breast cancer could develop in any part of the breast. That's the take-home message here, okay? So how does breast cancer develop? Breast cancer develops when normal breast cells undergo genetic mutation. Genetic mutation leads to the uncontrolled growth. Ibig sabihin, higit cells ko, tuloy-tuloy ni tuwala. Tuwa, boy control, boy tingla. So, dulay, tuwa ko, Next slide. As tumors grow larger and larger, they invade the surrounding breast tissue. Initially, tam breast area lang. But as it grows large enough, it goes to the lymphatics in the kilikili, and then eventually it goes down to the other parts of the body. So everyone, can you take a look at me? So kunyari, gusi lang no breast cancer, start kay sitam breast ko muna. Tuwa. Ikitaw kilikili, and then eventually it's ki ekalo. That's the normal route of breast cancer. Next slide. Knowing the evolution of breast cancer that I just discussed is very important because that's the basis of how we stage breast cancer. Stage 1, normally, these patients are those boybotyomykia, pero bantay quiet lang la. They check up, they do executive checkups, they do screening mammograms. So normally, patients with stage 1 breast cancer are those with incidentally caught breast cancer. Ganyan nga, incidentally. Nagkataon lang, uy, may bukol pala. Inubukol, pero diya bantay sa. Normally, that's stage 1. Stage 2, sige mga pinang ko, kat medyo pasaway ko, inbotyomykia ko, pero inbo check-up agad. In check-up, mga after 1 week, isang kointulo. Stage 2, normally, these types of patients have breast masses, medyo tuwalo, but it's still confined in the breast, din area lang la. Next. Stage 3, sige yung mga pilang pasaway pa talaga. Inbotyomykia lo, bobe check up pa rin. In denial, herbal therapy, YouTube, Google, bobe che isang. So in a cancer ko, tuwakilo ko, then tuwaki kilikili lo. These are the axillary lymph nodes. Stage 3 yan. And lastly, stage 4, these are the patients na tuwa, bo check up, kilikili, bo check up. Eventually, tuwaki, lungs, liver, bones. In short, kalat lala. Okay, so these are the 4 stages of breast cancer that everyone should know about. Because if the patient of pag-diupeng new chin, kandikong, I have stage 1 or stage 2, that person is considered early stage. If you pilang na kandikong stage 3, he or she is considered locally advanced. And lastly, if stage 4, obviously that's metastatic. Knowing the specific stage of breast cancer is very important because that will determine your prognosis. Meaning, as isang pinang takmay kung gunmang la, dok, wa pa ba, ku pa ba? The answer to that question is the stage. Because if you're stage 1, your probability of surviving is close to 100%. In short, di wala pag di stage 1, pag di sa stage 2, 90%. Still very good. If you do the average of stage 1 and 2, that's 95% survival. So bantay kuhi pa rin la. But if you're stage 3, bagsak na, 70% low. This is what we don't want. So you can see if you're stage 3, your probability of surviving is low. And lastly, stage 4. If you're stage 4, your survival rate, you can see here, is already 30%. And that's what we don't want. Okay? Next slide. So, the importance of this table is, it's very important to catch breast cancer early. Next. So why early detection matters? Sige ko, paulit-ulit kang lo. First, higher survival rates. Bukan din kung, if this is stage 1 or stage 2, your survival rate is more than 95%. Next. If you have early stage breast cancer, you need less aggressive treatment. Normally, if di ata breast cancer, kilay, diawlo, toholo. Di bo kaming chemotherapy, di bo kaming radiation, di bo kaming hormonal, di bo kaming targeted therapy. In short, diawlo, tag early stage. Pero if obviously you need more treatment. If you need less treatment, then obviously di bo kaming kaya to. If di kwa diawlo, di bo kaming heng chemo, lo bo kaming heng targeted. Hige na yakuy, hige mga yo bantay kuy la. Kwa yakin lang ya, shock lang. Pero hige yo la ya bantay kuy. And lastly, not only money, but the quality of life. I'm sure everyone knows if chemotherapy, yato'y side effects. Laktaw mong ya, lam, to. It's boycha, esan. So if di bo kaming chemotherapy, then obviously you'll have better quality of life. That's why if you have breast cancer, we need to catch it early. Next. So that's it for the second part. Now, the methods of catching breast cancer early. So statistically and evidence-based, there's just two methods of catching breast cancer. First, mammogram, and second is clinical breast exam. Let's talk about mammogram first. Mammogram is the gold standard for breast cancer screening. The reason why it's the gold standard because it's able to detect breast masses even before they are felt. Pag di kay x-ray din ko, di quite yung mga chidyap nila na true boybotyo. That's why it's considered the gold standard. A myth or a fake myth about mammograms is that yatsoy lang yakya ko is radiation. It will increase my risk of cancer higher. But no, statistics show talaga na mammogram bantay kela irradiation dose. You know, this is proven na 0.4 millisieverts per mammogram. Just to compare, if you do let's say a CT scan, that's 10 to 20 millisieverts. So even if you do 50 to 60 mammograms, iboy kawig radiation dose of a single CT scan. That's why the radiation risk is extremely low compared to the benefits. That's why we recommend mammograms. So currently, different bodies have different recommendations. Chikisaiko are the three largest societies tambikok that we follow. Whatever you follow, okay lang. These three are legit. These three are evidence-based, okay? NCCN, or National Comprehensive Cancer Network, which we personally follow, recommends mammogram for all women 40 years old and above and do this annually. Takni. The American Cancer Society, ikalinyan tampo ko, 45 years old and above, and then annually then. And USPSTF, 40 years old and above, and then do this every 2 years. So to get ko, yakin remember lang, whatever you follow, it's acceptable. Okay? But these are the recommendations that we recommend. So that's it for mammograms. Now let's talk about clinical breast exam. So clinical breast exam is basically having a trained doctor do a complete physical exam on you. The reason why tigaya bantay tiyong yaw ko is because isang, like for example, Guntam Hospital, guntak ditli kwa pilang la. So if di everyday li kwa pilang din ko, you'll know what's abnormal from normal. So once we see na, may something, we'll know na, this is something that we need to address. So what are the signs and symptoms that we watch out for when it comes to breast cancer? First, of course, is if the feel na udyu, tamdi din, that's the most common finding. Second is kilikili. Di ba kung anding kong pag breast cancer, it starts in the breast, then kilikili. So the kilikili is a part that we need to examine pa rin. Third is nipple discharge. Then nipple ko dapat boli labas ni kaya lang. Unless dito na you're breastfeeding, obviously milk. But if you're not breastfeeding, but there's discharge, bloody, yellowish, brownish, go see your doctor right away. Fourth is nipple changes or retraction. Then nipple ko or then dintaw ko dapat normal like itsura. But if it suddenly changes in appearance, biglang nagbaglikhi, or bigla piyan kailangan itsura, that's a warning sign. Fifth is skin changes. If your breast skin becomes something like an orange, kanang orange ki. Pongkan, kanang pongkan, kanang oaki. That's a warning sign as well. And lastly, if you have persistent breast pain, for no reason, di din bigla litya. Parang yatya, check up lo dapat. So these are the signs to watch out for. So when it comes to clinical breast exam, the NCCN recommends that you have it done as listed here. Every 1 to 3 years, if this is gohe to satsat kauhe. And then once you reach 40 years old, have it done annually. Next. So that's it for the third part. And for the last part, I'll talk about the high-risk features or the risk factors of what makes a person at risk for breast cancer. So who are high risk? First is age. That's why together forum Senior Awareness Forum. Because if you're a senior citizen more than 60 years old, you're already high risk for breast cancer. Second, family history. If di uchin lang, especially first degree, di mama or di shobe or di ati na may positive history of breast cancer, you are high risk for breast cancer. Third, reproductive history. If di yata getting less than 12 years old, you are high risk for breast cancer. If di thinking or menopause more than 55 years old, you are high risk for breast cancer. And lastly, if di never tuasin, that as well, unfortunately, is a risk factor for breast cancer. Fourth high-risk history is radiation history. Radiation here, I want to emphasize, this is not the normal X-ray, CT scan, ER, that's not considered. Radiation history is normally for patients with lymphoma. Lymphoma because it's treated by radiation therapy. So this is not the average X-ray lang, don't get confused. And fourth, obesity, high alcohol consumption, and sedentary behavior are high-risk features for breast cancer. If di apoy, if di din chew, kap di, body ting, tang tam chulay, body chok sit, you are high risk for breast cancer. And lastly, this is relatively new, genetic factors. Chichun ko, danukiyotsoy BRCA testing lala already. Before, this was unavailable. But thanks to artistas like Angelina Jolie, diba? Higa Bensing, Hollywood. She was the pioneer of making this genetic test famous. BRCA si Chikwan genetic testing ko, they check your blood to see if your risk factor for breast cancer is higher than the average person or not. Fortunately, damhulipin siya, dan ulo la. You just have to ask us kung talo English siyang. Pero we can connect you. We have the test already here. Okay? So, that's the last part of my outline. And just to make sure everyone learned something, I will summarize everything that we talked about again. Parang review lang. So first, breast cancer statistics. We mentioned earlier, breast cancer is #1 in whole Southeast Asia. Breast cancer is the #1 cancer of all females, 75 new cancers per day. We also discussed the numbers of Chinese General Hospital. We saw na dankyam effort pa to increase early detection rate. When it comes to understanding breast cancer, what I want everyone to remember are the stages. Stage 1, Stage 2, Stage 3, Stage 4. We want to catch cancer Stage 1 or 2 because survival rate is 95%. Methods of early detection, very easy. Mammogram and clinical breast exam. So in other words, diche isang lang takni para di sigurado. That's all what you have to do to be safe. And lastly, the high-risk features. We enumerated all of them one by one. I hope everyone remembered them. So to conclude, I'd like to share 4 takeaways. First, early detection saves lives. Ito, dan paulit-ulit kong no. Pero go ay longchong lang kay pasok din at haukak talaga. early detection saves lives. Second, your health is in your hands. We mentioned earlier, done kompleto when it comes to breast cancer treatment. We have everything that you need. Surgeons, radiation, chemotherapy, targeted therapy, hormonal therapy. We can't say na, sa Bicol lang yan, Hong Kong lang yan, Japan lang yan. No, we have everything that we need to treat breast cancer. Your health is in your hands. Din kulang effort lang para idyak-yak katsala. Third, screening is simple and effective. All big hospitals in the Philippines, not just Manila, in the Philippines have a mammogram. Even the big laboratories, diba, High Precision, New World, Accusel, longchong mammogram la. Clinical breast exam, I mean, doctors go to a hospital, pakuya doctor, so bantay choy, bantay choy, isang na talaga. So simple lang talaga to catch breast cancer. And lastly, when in doubt, visit your doctor. If everything I mentioned to you, you forget, trust you question, just schedule an appointment and then come personally na lang tam hospital. So with that, thank you so much for the invitation again.
Sa babi, isang wakaw siya ako, inyo sisikaw ako na ulang katin, kanat sila guest speaker for breast CA na lami isang la. Wakaling ko nga, sige breast CA, si duway ulang lami si ulang etyo din sige si duway lang. Kaya din lami naletsang ko, niya si to check din dito check din dito sosole kasi di ko din boka di so kasi sige ko po ikaw di po Dr. Christian Ang so far di encounter yo lami o breast CA mo.
Yeah. Gunu statistically ko 99% of breast cancers are found in females. 1% lame, ula talaga. Gun personally, practice, tutyo, invasive ductal carcinoma tam lame. Remember, chamagong hodi ko ay breast test, slides ay anatomy. U lobules, u ducts, u nipple, u areola, kap fatty tissue. All 5 of those parts, lame ula lame u nipple, diba? Lame u areola. Lame u lobules, then lakap ducts. It's not just well developed as that of females, but lame urin na. Okay? But statistically speaking, lame ka safe 1% lang. 99% duwe pa rin.
Since ko si ti radio, ti potswa, what takele interview isang ko, si kyote agarin sa official lady, choy lang le, tsegwa ko, toshong si too late lola, to si tamay Dr. Christian Ang ko, toshong si stage 3, pero kahan si 4 la, pero sinyo ngela, kasi egwan in ko, choy, yakyat samla, asi yakyat sa iya na iyo utakay iyo bukolo, ito chusot lo. So, kaya, President Mr. Sami, kaya George Go, itang si ili kawa request na may namin song sige forum. So, wa talaga ihawak yung kwa ay kang siyami ko. My number 1 is breast cancer. Baka di ko nga, si breast cancer, si yaman tay choy ngayon wati choy, wale choy, gundi choy kicha ko, gundo le pili, kwa gun may focus on sa may topic la. Gwa si Coco, the only Filipino Chinese media, wale cover PhilHealth, SSS, Pag-ibig, DOLE, DNR, BIR. Pero ang choy long chong ko, si Tsunowa talaga focus ti PhilHealth la. So, kanat siguro na focus ti PhilHealth kasi sige din ko, talaga grabe soy lola. So, Dr. Christian toshong chong nalikili chedi ko, hindi na toshong nakichedi toshong, hindi na kay kapa, si bukol si tualo, asi, o discharge lo, kayo kumbaga nakichedi toshong si, di kwa toshong si stage lo.
The most common breast cancer pa rin ko, fortunately, is stage 1 and 2, which is good. Okay? Diba kung andin siya maho, ni kwa statistics naman the hospital where we practice, at least go evidence to back it up. More than half is still early stage. But I can't speak for the other hospitals ng pati probinsya. Di ba, Philippine ya, tuwa ta mga probinsya, hiya mga lang, the invoy kawe, invoy tayo, dali kang sime so hiya awareness rate ya, kiela. That's the reason why nationally, 30% pa rin. But here in Manila, I would say the big hospitals, more than 50% early stage, which is good. But I can't speak for the rural provinces.
Kasi di na kapatyo o bukulo ko, di na kitse isang通常計刮起嚟啊，所以數格燈啦。我計佢有用嘅啲啦，我計佢點幫個，我咧 ultrasound 個，有看到個 Dr. Samuel ang impapa，ikaw看 Hilda 自己咧就話佢計刮起嚟，呀，所以咧佢話佢 outpatient 隨時tanggal咯，所以冇大志咯，啲納到啲坑，啲到啲驚，啲唔敢俾佢睇醫生個，我有用嘅啦，我先講會，然後再呀自己。佢有些講話個是為咗無錢個，無去找醫生啦，無要去找醫生個。第二有一個naman ko唔敢話個，是我talaga我咧tulong lang ko，pwede俾佢多一個邊處個。所以咧重點咯，第個diablak，我就是同你講咯啊，第個diablak重點俾有個 PhilHealth consulta，個 PhilHealth consulta ko，di mo watang ki register。Kasi PhilHealth may sagot higit consultation, di may pala isang le. Ngayon, si doktor, di nakitse, nakonsulta, nakwadyo, dito suyaw mammogram, asi suyaw ultrasound. Sige, libre PhilHealth saguta. So, ay Dr. Cristiano, pepet yung, kasi sige breast cancer CA, talaga yaman tayo soy. What talaga si Chud? I guess, chong din for breast cancer for CA ko, PhilHealth is a good 1.4 million. Kaya di ba abiligay 1.4 million na kung di na paimyalo, dito chusut, dito chemotherapy, dito radiation. Kung saan si Dr. Christian, nika din pongti, early detection is the best din na, ni kwa kito chay isang ko, ni nakat sa ko, less expense. Di sukat kasoy. Di kaku compare. Di ba pwede kay delay. Di mantay paimya. Tapos di ko saya, kaya di waku, di ba? So, dito ko kaya ay tiyatet kang sige breast cancer ko. Dr. Christian, bityo nga di sa maka, di slide ko, di siya, 40 years old, sa si, betong hige mammogram. Pero lang tan si no lang kwatyo ko lulay lu xiao lian u dia puihe u breast cancer u sa sa puihe breast cancer so lang wat ang kala ne try senior ino sa abawa simple tyo chunga chongwata.
Yeah, so hige table na go holding kwa ko hige 40 years old. That's for the general population. But in the last part, I listed down all the high risk features. If you know someone who have nag-check doon sa high-risk table na yon, all the recommendations that we mentioned, you do it earlier. Okay? So, kunyari, satsap kuihe, parang ang satsap kuihe. Di bo, kaming tan kao si tsaphe, siya become vigilant la. If you feel something again, check up agad. That's the reason why, when it comes to clinical breast exams, 25, as early as 25 years old to 39 years old, you need to see a doctor every 1 to 3 years. Di kili, diba? Kung hindi kayo second recommendation. So, sige, di mang siyang mammograms pero at least you need to see a doctor. And that's proven recommendations.
Dahil walang may mga question.
Doctor, good afternoon. 我一個朋友個吼，伊是18年前掛掉咯。像我是就 regularly 去 check up 吧，是 after 18年前發作哦，去天堂咯。我咧奇怪是講會個發作吧，還是就 yearly 就去 monitor 啦。路尾袂好啊，18年後哦，救袂來啊。spread 去龍江嘅 internal organ，冇咯。
For patients na dindiw na kwa loki-loko, surveillance ya bantay tiyong yaw. Gun style ko is kunyari gun kwa pinang, gun personal style kwa diaw 1 month, check up. 3 months, check up. 6 months, check up. 12 months, 1 year, check up. Kasuy na ka kunige intervals, especially if you high risk kaya pilang, gun ka gunya praning kasi, gun ka ay close check up. Yaking check up lang keeping lang, keeping true. Kung oy, examine lang. Simple lang.
Kung usapan after 22 years, sige, after 22 years, sige, after 25 years, nakaroon siyang breast CA recurrence. So, sige nila, o breast, mapaprostate, si breast, sige ko, dito, yearly check-up, dim lang ko, ay, why can, holo. Daw sige naman ko, Doc Christian, kasi sitso na buntoy ko, yatsoy na kunwari detect yo, na ko, o breast cancer ko, wake ya chusut. So, ang initsong ko, inasikit sa alternative. Alternative diawlo, sa kwadyo, dine, yes, susule, nuwalo, sa watlay, di ututyo, choy, case mo.
Bantay tsoy. Alternative medicine ko is, honestly, uhoran la alternative medicine, pero they don't have data to back up their treatment. Pag di siya mga alternative medicine, kasi din mang what's the active ingredient? Hindi ho, di box na, bo siya puwahang, din siya mechanism of action. Di ka nito, do you have evidence that this is proven? In bo back up. Bokap mga yo sang tampichu. Pag din kay che online, you'll see journals, you'll see tichele. Kumbaga may numbers. So alternative medicine is very, yakang kosin. Gunyat so ipilang na anila, lalo na yung mga kabotsing lang They see us stage 3 na, stage 4 la. Unfortunately, they have to undergo neoadjuvant treatment muna, but they couldn't afford it. So eventually, it do progress. So in a prognosis, high.
Hindi na kaya huwaliaw ko, dim tang niya la. Kasi huwaliaw ko, si capacity, good and bad cells. Pero, after that treatment, after, kuya session na,
Depend, 6 sessions, 8 sessions.
6 or 8. So, di na after the chemo session, after 3 months, 6 months, di back to normal di ketsay Jose compare din na naaswi kitse alternative medicine ko. Di after that, alternative medicine, ibuat ang pasidi kay cancer cells So, iliho di, kay tele lang la. Yung si kadi tele ko, te akaw bukaya loko. Penso ya, grabe lola. Di na ya, penso ya, grabe. Di siya kasi Dr. Christian, so far, we encounter, why tagesilis, kaya chusut la. So, di na kaya chusut ko, di na sui alternative, to bole ko alternative pa wasile ko, di na sui kwa isang kong siya, dito na sui kaya isang Tana longzong chong diao lo, di ki alternative medicine. Di ki regular check-up, di ko ay po, di ba? So, sige, breast CA talaga si yaman tayo tsoy. Tongsyo kaya, kana sila tsoy ko, stage 3, tawe stage 4. Tsoy si uito, tagelik niya, bobek, che isang tagelik niya, higit kwala. So, what's it mong Dr. Christian? Tiyongin na si, napilang na si stage 3, katwa, hope pa rin ba?
Survival rate is 70%. Proven na yan. But yapay kasi pag stage 3 ko, there's already lymph node involvement. Diba kung anikang, so ni kay shu, if you bukol siya, natwaki lymph nodes lo, we know eventually it will go down to the whole body na. So pag this is stage 3, expect you will be needing not just surgery, but additional treatment nila.
Kaya sa din na si breast cancer ko, na early detection ko, na soy diu pa lang ko, na kuakilay ko, wawatang ading ko, wag yung tutoy at suelo. So far, longzong si stage 1, 2, longzong yak, yung longzong diagoni, yako tile pa, bo sinsin cancer. Another question.
Christian 較精彩。你前面說講男嘅就 breast cancer，OK？ 你這個patient是真男嘅，還是半夜啊？
Good point.这个是加拉面啊，加拉面。Good point. Diba, iga siya ako ay point because mga puaya men na lead din mga hormonal replacement. Diba, inay din, so if they drink mga estrogen, progesterone hormone replacement, that will make the other parts of the breast, yung lobules, ducts, active. So pag active yan, so yung risk for breast cancer kung iko, diba? Dan kang tama lami kasi underdeveloped compared to duwe. But if you get lami na nang buay kay make it more developed. So it's as if EIP ang duwe. So statistic rate kung iki din ko. Diba? From the 99 versus 1% baka kung iki tampo.
Okay, thank
diba?
you.
Very
Good point.
Good point.
Cha lami tio breast cancer. Kaya de shareholding na sige si duwe lang. Pero din lami kasoy chance la 1%. Oh, diya ulang ko may mga question ko.
Is it true daw, Doc, pag type A blood is prone to cancer?
Type A, I guess si sure pa, bo proven. Body guidelines
question
pa.
din ako. Pag stage 1 cancer, sabi mo, no need for chemo, targeted. Pero sinuggest ng doktor mag-target. What effect mangyari? And
Yeah.
nagre-recur ba pag stage 1, natapos mo yung targeted chemo? Babalik ba siya? Kasi usually, di ba, bumabalik yung cancer, pero sa ibang part na ng body.
Yeah,
So
I
pag
guess-
stage 1 ka, is it may possible na
Mag-recur. Yes.
reoccur?
Okay. Very, very good question ko, Tsaka actually, go ay kapding kang ko, pero yam breast cancer ko, yatsoy subtypes la. Every time we biopsy a breast cancer patient, we check what you call the breast panel. I'm sure din pati ko lagi mga hormone receptor positive, hormone receptor negative, ERPR positive, HER2 targeted therapy subtype of breast cancer. Pag this is stage 1, na this is HER2 positive, the probability of receiving targeted therapy, even if you're stage 1, tihala. And the reason why is because then yak niya recurrence nga. Okay lang. Di ba siya magawaning kwa? Babo siya 100% na just 100%. We put approximately 100% there. Because the medicine ko, there's no such thing as 100%. Guno mga pinang stage 1. Boom! Di kaya ito, sihi. At the same time, guno stage 4, goniwa pa. So there's no such thing as 100% lata medicine. Everything that we're reporting is just based from our database.
Dok, si ako din ako ni prescribe tamoxifen po
If your indication of ER/PR positive,
What ko, why did take tamoxifen ko, ang next nagiging cancer niya, na Spencer uterus cancer. So, higisi ito siya, I get tamoxifen, doon na naging side effect.
in chong risk-benefit study nila because if tamoxifen leads to gynecologic cancer, then why do we recommend it? This is very similar to the explanation of Dr. Schauberg Chama about metformin. If the drug is really effective, if the benefit outweighs the risk, then we should still prescribe it. Gynecologic cancers ko, tam uterus, yakin diya din na similar to breast. So if you could do it din tamoxifen, tapos quick abnormal uterine bleeding, check up agad, tenko, and then do the necessary treatments. But it's not strong enough to stop the hormonal therapy.
And then my last question, this amount you mention, na why bosikay? Kasi sitson, panahon ko, yatsoy bo, can't you, bo besika? Diyo talang yatsoy, kwato yatsoy, why senior ladies talaga bo, can't you? Kana, tongsyong init yung breast cancer.
Dibalgo kanling chama hoding kwa. There are 3 reproductive history features that we check. First, early menarche or early getting, maaga nagkaroon ng mens. Second is late menopause. And third is never got pregnant. The reason why is if the patient is pregnant, the risk of breast cancer decreases. because if your hormone surges decrease. Remember the question, everything is connected eh. Tsaka uncle mong someone taking hormonal pills, tataas yun for lami, itaas yung cancer. If dito there is what you call parang hormone day. So, your breasts will become inactive. Parang ganun. That's the layman's explanation of it. If it's inactive, then the probability of having uncontrolled growth of breast cancer cells will decrease. Gets you ba? I'm trying to explain it for a lay person kasi, in short, magkaka-break ang breast for development. Parang ganyan. Yeah, tiyak.
Out of curiosity lang, pag ang babae ba may boyfriend at walang boyfriend, I would say, ewan ko kung paano sabihin, chance of getting breast cancer, is it higher, lower, or bigger boobs, smaller boobs, all these things. It has no connection, no connection.
Meron akong meron ako, actually, di question ko, Dr. Christian, kasi, sige, si di papa, kawako, di papa, kung kawali piola, pag naduwi, botutut yung o boyfriend la, kahit walang asawa, kasi ang sabi daw, pag sige duwe, nakapa, na yatsoy, ultrasound kwatyo yatsoy nodules, pero si cancer, pero cystic, di ba, yung matubig. Ang sabi ng papa mo, Dr. Samuel Ang, kapag sige duwe daw ko, active sa sex, boki daw ba? Same as sa lami. Dr. Jason Letran, same sa lami ko, na yasyong less sex daw ko, kapoy tiyo prostate cancer ba?
lame在lame你愛我同你我要講啥物正式的話你要叫我講正式的話還是科學根據的話還是恁愛聽的話啊Okay, so 我若照科學根據，我是也佫無一個正確的科學根據說，你做宣告會較袂毒瘤啦，喏。但是有一個 studies 咯，伊個有小可說，唔是宣告啦，射精啦，啊，可是 ejaculation 無拄拄就欠明 sex 那麼呢，對吧？kaya hindi excuse, hindi pwede sa yung Dr. Letran said in the ejaculation, so it's a big no, hindi pwede. But ejaculation ang pinag-uusapan ito, na ejaculation. Di na si Chow Wai Ko Kun Kuseo, kailangan ng 21 ejaculation a month, no? Para mas makababa raw ng incidence sa prostate cancer. Pero, igay ako, si Cheng Shak, kunku pala, no? Pero yan ang suggestion. No? So, ang point ko is, di na ayo, chong bè kin na, no? Di na bo ay, bè tutu sa di bo chong,就bè sin tok diyo na lang, no? Kasi, di ko pare, chow gun statistics, agun ko abo chin choy pare, prostate cancer na. Kasi ang sagot, bo tutu tagay pare, bo le chong naman, di ba?
Tuto kanchu la kasi chun panahon ya open la basta unya na ikasyong lex kau lame sex kasyong hoge lame so i din ko eka breast cancer.
Well, similar to the Dr. Letran ko ang example, yakan ko prove lagi. But if you think about it, if someone massages the breast of a girl na he could do it parang audit ba? May auditor. Oy, may something ka na. So maybe it could help with the early detection nga. It could. Yeah.
Good afternoon, Dr. Christian. My question is, after giving birth through pregnancy, when can a woman do her breast checkup without misleading results? Kasi just a little background, I was detected to have multi-clustered benign cysts in both of my breasts 5 years before my pregnancy. Thank you.
So we get, sorry, I'll answer in English, okay. There's no recommended number of months, but just think about it. Every time you give birth, you need to do a checkup with your gynecologists, right? It's part of their full physical postpartum examination to check your breast. So that's the answer for that. If they don't feel anything, then good. But if they feel something, most likely they would recommend an ultrasound at least. But my answer to your question, if you feel something new, if you see the warning signs that I showed you a while ago, lump, nipple discharge, nipple change, breast pain, axillary lump, any of those, check up right away. Don't wait. Let's say if it's 1 month, check up. 2 months, check up agad. Gets? Yeah.
Doc, may nagpapatanong lang po dun sa katabi ko kanina. If senior citizens, women, are required to do mammogram, how about for men daw? And what checkup would it be?
So I mentioned earlier that 99% are for women, only 1% are for men. That's the reason why the guidelines for men is not that strong compared to females. If the male, however, has high-risk features, say for example the genetic test that I mentioned, BRCA positive, or he has multiple first-degree relatives, we would recommend an ultrasound to a man, not mammogram, because there's nothing to press there. Ultrasound, breast or chest ultrasound. Gets?